Hi, I'm Dr. Shefali Tyagi. I'm the practicing obstetrician and gynecologist working for Motherhood Hospital, Sajapur Road, Bangalore, India. How to recognize implantation bleeding? Now you're actively planning for pregnancy, and to your horror, you realize that you're bleeding on 22nd, 23rd day of your periods, which is a very light kind of bleeding, but you're not sure what is happening. Well, it could be implantation bleeding. What implantation bleeding means is that when the egg is fertilized by the sperm, the fertilized embryo, it moves through the tube and into the uterus, where it burrows into the wall of the uterus to make way for its growth. So when it is going through the wall of the uterus, that is the time you can have some spotting or bleeding, which is called implantation bleeding. If you have very regular cycles, generally you ovulate around 14th to 16th day of your period. So in that case, the implantation bleeding can be from 22nd to 26th day of the period. Anytime, it can vary from person to person. The nature of this bleeding is that it can be a very mild pinkish discharge to a little spotting. And the duration of bleeding can be very short. It can be either only for few hours or it can be only for a day or two. So basically, it indicates that you could be pregnant even before you can test with beta-HCG. So need not worry, just wait on. If the bleeding persists, you need to see a doctor that what's happening. Otherwise, if the bleeding stops and you miss your periods, the first thing you should do is test for pregnancy and then go and visit your gynecologist to update what is the status of the pregnancy test.